Hey, I'm Wendy. Welcome to the RN for God show. As a trusted healthcare professional, a RN for the last 24 years, I want to help you to discover how to be healthy. I'm going to guide you through the myths, the facts, and the essential tips that you need to live a high quality of life. The Bible says in John 10:10, Jesus came that we could have life and have it more abundantly. And I believe that he meant for us to have that on earth. Let's dive in, learn about health strategies so that you can live that abundant, healthy life right here on earth. Hey, welcome back. Yay! To the RN for God show. Welcome, welcome, welcome. So today we are going to be talking about cardiovascular disease. So I do work in the cardiovascular ICU. However, I am in school learning, so I have a lot of information coming and going out of my brain. As you learn, information that you have already learned moves to another area. I call it file cabinets in your brain. So sometimes you have to think really hard to pull things from the back of your brain to the front of your brain to remember them. So I'm going to be looking down at my notes because I want to make sure that I'm giving you accurate information. Okay. So today we're going to talk about cardiovascular disease. So a little bit of basic anatomy, because as an educator, I am also a nurse educator. I do not take an assumption. I don't make an assumption on what a person actually knows, because there are some people in the room that don't know, but they are too embarrassed or whatever reason, don't say that I did not know this. Because Americans, we shame people all the time for whatever. Anyway, I'm not going to go there. So, some basic anatomy is you have your heart. Your heart, boom, 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 is a muscle. So, your heart is a muscle and it pumps to produce, to filter blood, to push blood out through your entire body. Your heart muscle is probably about the size of your fist, and it lays in your chest, and it is connected to arteries and veins that pump the blood throughout your body. The arteries bring the blood into the heart and the lungs, and your veins bring it back to the heart and the lungs. So to get oxygen, the arteries have oxygenated blood and the veins have deoxygenated blood, meaning no oxygen. So why is that important? Because we need to understand that the vascular system is little 3 layers, but it's very pliable and it could be damaged. So as it is maintained by pressure. So as the heart is pumping the blood, that is a form of pressure. That pressure is coming from, it's called an ejection fraction of how much the force is of the blood pumping out of the heart to get it all throughout your body. So as your body is being filled with your blood, it has to go up to your brain and all the way out throughout your body. So your arteries and veins, think of them as highways in your body, bringing in and returning blood, bringing blood to the heart and putting blood out of the heart. So we all need to do that to live, right? So the reason that I'm talking about the pressure of it is because high blood pressure is a real thing. Once you are diagnosed with high blood pressure, you will always have high blood pressure. Did you hear me? I'm going to repeat myself. Once you are diagnosed with high blood pressure, you will always have high blood pressure. Now, that does not mean that you will always have to take medication, because just because you don't take a medication, just because your blood pressure is lower, does not mean that you don't have hypertension. Okay. And I know people will talk about different things, and I've seen different things on social media, but again, everything is not accurate. Okay. High blood pressure from the American Heart Association says that 130, the top number, over the bottom number, 80, consistently means that you have high blood pressure. Now, at that rate, you might not need to have medication because you have to take other things into consideration. You may have other disease processes like diabetes or renal failure or other things. So it depends on what else you have going on, what your risks are. If you are African American, Black American, because we are at risk for more things than anybody else. Hypertension is one of the deadliest things that I have seen as a nurse in all of my career. That and strokes. What leads to strokes? Uncontrolled hypertension. So, some of the events that can occur with high blood pressure, renal failure, and strokes. Now, you know a pressure cooker, right? So if you have a person that has high blood pressure, they don't go to the doctor, and they have headaches occasionally, maybe some dizzy spells every now and then. So think about a pressure cooker, right? And that pressure is there. If you go to your pressure cooker and you don't release the pressure and you take that top off, everything that's in that is going to, boom, explode. And that is what happens in the brain when you have someone that has high blood pressure and it is uncontrolled and they are under stress, or they get on a ride in the amusement park, or anything could happen. I'm going to tell you the story. And this is not about any particular patient. This is about what I have seen. So I live in Central Florida, the home of Disney. I worked in a hospital where we would get patients, and oftentimes I would have patients that were there because they had a brain bleed in their head because they had undiagnosed hypertension, were riding on a roller coaster, and they had an aneurysm. That is when that pressure, you take that top off of that pressure cooker and it explodes. So you have to keep your blood pressure under control. How do you do that? Well, while you are working on diet, exercise, you should be on medication. You should definitely be on medication. Now, one of the things that people say is, oh, I'm not going to the doctor, or I don't have insurance or anything like that. Most areas have free healthcare clinics or pay by what your income is. But you should definitely see someone about your blood pressure. If you're not sure, go to CVS or any one of the drugstores. Get your blood pressure taken. Buy yourself an automatic blood pressure cuff, even though I don't really like those, but that's better than nothing. Get you an automatic blood pressure cuff. Take your blood pressure when you first wake up, after you eat, maybe a couple of hours later after you're up and moving around, and take it again before you go to bed. Make a record of that. Do that for like a week. Let your doctor see that. And then they can be able to tell you if your blood pressure is high or not. Because a lot of times when people go to the doctor as well, they get this thing called white coat syndrome. They get nervous and stressed and all of these things, and their blood pressure automatically goes up. That's a real thing. But I say, before you go, track your blood pressure, at least for a week, so that your physician, your physician's assistants, or better yet, your nurse practitioner. Yes, I said better yet, because that's what I will be soon. Your nurse practitioner, to be able to help and sit down with you to discuss a plan. So everybody is different. It doesn't mean that you will have to have medication. It means that you have a diagnosis that you need to take care of. We as Black people often like to push things under the rug and not really pay attention to what the doctor is telling us. Sometimes we think that we know better because we looked at Dr. Google. Nah. Dr. Google shows you a generalized picture of population. You put in different symptoms and all, it shows you a generalization. So, examples of what can happen. I told you about a stroke. So you have two types of bleeds, two types of things that can occur with a stroke. One is a brain bleed. That is where, like I said, the pressure cooker and your vessel can pop in your brain. And in your brain, you have three areas. You have your brain, you have cerebral spinal fluid, and these are all inside of your skull. Your skull is bone and it doesn't expand. So you have your brain, cerebral spinal fluid, and the blood that's in your arteries and your veins. If a vessel breaks, all of these things, let me go back and say this, all of these things are in a perfect symmetry in your brain. If your vessel ruptures and the brain starts to touch the blood starts to touch the brain tissue, it becomes irritable. People can have seizures. But more importantly, if it gets into different areas, it can cause death. It can cause debilitation. And we don't want that, right? We don't want people to die early, to die young. We want people to live. I saw a meme once that said that young black men deserve to live. And it was referencing something else, but middle age, young adult, black people deserve to live as well. And we do that by taking better care of ourselves. So, signs and symptoms of a stroke. Remember fast. So facial droop, arm weakness or numbness, speech difficulty, time. Call 911. So next time, we'll talk about something different. But for now, go check your blood pressure for a week. Let your doctor see it. All right? Thank you for listening, and I'll talk to y'all next time. Toodles. Hey, thanks for tuning in. Remember that your health is your wealth and knowledge is power. So like, share, leave me a comment, send it to a friend. And thank you for tuning in. I'll see you next time. Toodles.